Okay, let's unpack this. Imagine a world where materials are so incredibly tiny that we can fundamentally reshape them, giving them entirely new superpowers that can change medicine, revolutionize our food, and even alter how we build cities. But here's the critical question. What if those mind-bogglingly tiny changes come with colossal, unforeseen questions about our health, our environment, and our very safety? Welcome back to the Deep Dive, and if you're joining us for the first time on the English Bookcast, well, you're in for a profound and fascinating journey today. We're taking a deep dive into nanotechnology, an incredible, almost futuristic field that promises, revolutionary breakthroughs, but also brings with it this complex web of environmental, health, and safety considerations that we, as a society, are only just beginning to grasp. Our mission today is to explore this breathtaking and sometimes challenging landscape, guided by a stack of expert sources you've shared with us, to give you a true shortcut to being well-informed.
Indeed, we've had the privilege of delving into a range of insightful contributions that really highlight both the immense promise and, well, the critical questions in this field. We're looking at works like Nanotechnology, Environmental Health and Safety by Abhishek Gupta, which sort of lays out a crucial framework. And alongside that, nanotechnology, the risks and benefits for medical diagnosis and treatment, which gives a really focused look at its medical implications. Then there's nanotechnology-related environment, health, and safety research, examining the national strategy, which provides more of a macro-level view of our collective approach. What's truly fascinating here is how these diverse sources illuminate the dual nature of nanotechnology. Its boundless potential for good intertwined with the profound need for careful, responsible stewardship as we manipulate matter at the nanoscale.
So what does this all mean for us? For you, the curious learner, we'll distill the most important nuggets of knowledge, give you those genuine aha moments, and hopefully leave you feeling truly well-informed about this cutting-edge topic, all without the information overload. Let's start right at the beginning. What exactly is nanotechnology and what makes it so revolutionary?
Okay, so at its core, nanotechnology involves developing and using materials, structures, devices, and systems where at least one dimension is incredibly small. We're talking specifically between approximately 1 and 100 nanometers.
Wow. Just to kind of get our heads around that scale, how small is that really?
Right. It's hard to visualize. A nanometer is a billionth of a meter. Think of it like this. If a single human hair were stretched across the United States, a nanometer would be like the width of your fingernail. It's engineering at an almost atomic and molecular level. We're not just making things smaller, we're fundamentally altering their very properties. It's this manipulation of matter at such an unprecedented scale that leads to entirely novel functions and behaviors that we simply don't observe in their larger bulk forms. It's truly about engineering at the most fundamental building blocks of existence.
That's truly mind-boggling. So we're essentially talking about unlocking a whole new, well, almost a new periodic table of possibilities just by shrinking things down. It really reframes our understanding of what materials can do, doesn't it?
Exactly. When you get down to that size, materials don't just become smaller, they essentially enter a different realm of physics. Often they're governed by the strange and wonderful rules of quantum mechanics, which means that a material known for its strength might suddenly become a powerful electrical conductor, or a common substance could gain incredible catalytic abilities. It's like unlocking hidden superpowers in everyday matter.
And these are the unique characteristics that make it so powerful. We're talking about materials that are sought after for enhanced uh, pharmacokinetic properties. What does that mean exactly?
Yeah, pharmacokinetics, that's basically how the body processes and distributes a drug. So nanoscale materials can allow for more effective and localized treatment, much more targeted.
Okay.
Or enhanced catalytic properties, where these tiny particles can dramatically speed up chemical reactions. Think more efficient industrial processes, cleaner energy solutions, that kind of thing.
Got it.
And beyond that, they offer novel porosity, electromagnetic behaviors, and dramatically altered surface
Oh,
properties,
yeah.
like vastly increased stiffness, elasticity, or strength, significant weight reduction, or even those consumer-friendly features you see advertised, like easy to clean or scratch resistance.
So these aren't just minor improvements. They're fundamental shifts in how materials behave.
Absolutely. And many brilliant minds are at the forefront of this. Researchers like Elke Fink from the University of Freiburg, Arnaud Magrez from EPFL, Eileen D. Kumpel from NIOSH, and others like Alberto Garcia, H. Amy Feng, Berngies, their foundational work across various institutions is truly pushing the boundaries of what's possible.
Amazing. So the scope of these materials and their applications is incredibly diverse,
Right.
reaching into almost every aspect of our lives, often without us even realizing it.
Precisely. Our sources highlight a rapid, almost exponential increase in commercially available products incorporating nanomaterials.
That's astonishing.
Yeah.
So we're not just talking about futuristic labs. These nano-powered innovations are already in our homes and hands.
Very much so. As Charles W. Schmidt points out in nanotechnology-related environment, health, and safety research, we're already interacting with nano-enabled products every single day.
Like what?
Well, it's everything from the sunscreen we put on our skin to the tennis rackets we play with, and even our high-tech electronics like iPods back in the day and smartphones now.
Wow.
Lux Research, a leading market analysis firm, estimated that back in 2007, nano-enabled product sales were around $147 billion globally.
Okay, that's already huge.
But here's the jaw-dropping part. Their analyst, David Huang, predicted that figure could skyrocket to top $3.1 trillion by 2015.
$3 trillion. That kind of growth isn't just an economic trend. It truly signals that we are in the midst of a new industrial revolution driven by the infinitesimally small.
Absolutely. And the broad commercial availability extends far beyond those examples. Think about your daily routine. Nanomaterials are in a wide range of cosmetics, making them more effective or longer lasting. They're embedded in advanced coatings, adding durability or self-cleaning properties to surfaces.
Right, I think I've seen those.
They're woven into food and beverage packaging to improve shelf life and maintain freshness. In sporting goods, they enhance the performance of tennis balls, golf balls, even bicycles. They're critical components in electronics, advanced batteries for more efficient energy storage, and even specialized fuels and paints.
Even cement. Really?
Surprisingly, yes. They're even being incorporated into cement to create stronger, more durable structures, potentially transforming infrastructure development. It's truly ubiquitous.
That's incredible. So if we're manipulating matter at this scale, what are some of the most profound impacts we're already seeing? I imagine medicine is a big one.
Definitely. This is where the profound implications emerge, especially in the medical field. Nanoscale particles are fundamentally changing diagnostics and offering novel interventions for disease treatment. We're talking about enabling highly specific and targeted probes, advanced molecular imaging, extremely precise drug delivery systems, even things like vaccine delay release applications that could revolutionize global health.
Let's really break down some of these medical marvels, because this is truly where the science fiction starts to feel like reality. Tell me about targeted drug delivery first.
Okay, targeted drug delivery. This is a potential game changer for so many diseases. As discussed in nanotechnology, the risks and benefits for medical diagnosis and treatment, nanomaterials can act as tiny, intelligent couriers, transporting therapeutics directly to specific disease sites.
Why is that so crucial?
Because it dramatically reduces off-target toxicity. That's a massive problem, especially for powerful drugs like chemotherapeutics used in cancer patients, where side effects can be debilitating, sometimes even life-threatening.
Right.
By delivering the drug precisely where it's needed, you can, in theory, flood the disease cells with medication while minimizing harm to healthy tissues. This makes treatments potentially far more effective and tolerable.
Imagine a cancer treatment that targets only the tumor, leaving healthy cells untouched. That's the dream, right?
That's the promise, yes. However, achieving this precision isn't simple. It requires cutting-edge analytical chemistry to meticulously engineer the nanoparticle surface. Think of it like carefully attaching tiny molecular address labels to ensure the drug travels only to the diseased cells and nowhere else. It's a really delicate dance of chemistry and biology.
A complex scientific challenge to ensure both safety and reproducibility, I'd imagine.
Absolutely. And building on that, improved medical imaging and diagnostics are also seeing incredible advancements. These promise earlier detection and a more precise understanding of diseases. Nanoparticles can specifically target diseased tissues, allowing for resolutions and clarity currently unattainable with existing technologies.
Like what, for example?
Well, for instance, quantum dots. These are semiconductor nanocrystals. They show immense promise for early cancer imaging and detection. Researchers like Pericleus and others highlighted this back in 2012.
So catching diseases much earlier.
Exactly. This early detection capability could vastly improve treatment outcomes by catching diseases at their most treatable stages. Furthermore, and this is truly exciting given the looming global crisis of antibiotic resistance, some nanomaterials are even being developed as alternatives to conventional antibiotics.
Wow, really? That's huge.
It is. We desperately need new tools in the fight against resistant infections, these so-called superbugs. The ability of nanoparticles to physically disrupt bacterial membranes or interfere with their life processes in novel ways offers a new front in this critical battle. They might circumvent the very resistance mechanisms that render traditional antibiotics ineffective.
And the innovation truly doesn't stop there, does it? It extends beyond human health, too.
Oh, yes. The potential in food preservation and safety is equally compelling. It offers revolutionary ways to combat food spoilage, enhance shelf life, and even detect contamination.
How does that work?
Well, our sources detail innovations like intelligent nanocoating films. Think of them as microscopic sentinels. They can actively indicate contamination or precisely monitor gas content within food packaging.
So, like, the package itself tells you if the food's gone bad.
Exactly. Imagine a scenario where a package subtly changes color to alert you that your food has begun to spoil before you even open it. That could dramatically reduce waste and improve consumer safety.
That would be amazing.
There was one remarkable study by Yu and colleagues in 2017. They showcased polyvinyl alcohol chitosan polymer-based films infused with silica nanocomposites. These weren't just a minor tweak. They significantly reduced oxygen and moisture permeability, leading to an astonishing threefold extension in the preservation time of cherries compared to traditional packaging.
3 times longer. That's not just about freshness, that's tackling waste on a massive scale. It touches on global food security, economic efficiency.
Precisely. And that's just the beginning for food tech. We're also talking about direct antimicrobial packaging itself. Nanostructures of magnesium oxide, or MgO, for example, have been developed by researchers like Swarup and Shukla in 2018, specifically to protect against persistent bacterial biofilms that can contaminate food. Additionally, zero-valent iron particles can act as highly efficient oxygen scavengers within packaging, further extending shelf life by preventing oxidation.
And you mentioned silver earlier.
Right. What's truly widespread and fascinating in this area is the use of silver nanoparticles.
Ah, silver. It feels almost ancient, like something my grandmother used, yet here it is at the cutting edge of nanotechnology. Why are silver nanoparticles, or Ag plus M, so effective?
Yes, silver nanoparticles, Ag plus Ca, are widely employed due to their known potent toxicity to food pathogens. Their mechanism is quite aggressive and multifaceted. They increase bacterial cell membrane permeability, essentially creating holes that compromise the cell's integrity. They can degrade lipopolysaccharide, a key component of bacterial outer membranes. They can also damage bacterial DNA and critically inhibit the synthesis of adenosine triphosphate, or ATP, which is the vital energy currency for any cell.
So it attacks them on multiple fronts.
Exactly. This multi-pronged attack ultimately leads to cell death, as Marones and others described back in 2005. The effectiveness is significant. For example, Arfat and colleagues in 2018 showed that bio-nanocomposite films with silver-copper bimetallic nanoparticles have significant antibacterial potential against serious pathogens like Listeria monocytogenes and Salmonella enterica.
Which are huge concerns for food safety.
Absolutely. The implications for public health and reducing foodborne illness are immense.
That's a powerful combination of ancient knowledge and cutting-edge science. Okay, to truly understand how this delicate balance of promise and, well, potential peril plays out in the real world and how we can navigate it successfully, let's shift our focus. Let's look at a remarkable success story. Nanocrystalline cellulose, or NCC. What is that?
NCC is a truly novel and renewable nanomaterial. It's derived directly from cellulose, which is, the very building block of a tree's strength. It's essentially taking nature's own robust engineering and scaling it down to the nano level.
Nature's engineering, scaled down. What's so special about it?
NCC possesses some truly unique and astonishing properties. It's reported to be an incredible 10 times stronger than steel at the nanoscale.
10 times stronger than steel. Really? At that tiny scale?
At the nanoscale, yes. It's astounding. Beyond its strength, it also has the ability to form vibrant structural colors without the need for any pigments. It's just how light interacts with its nanoscale structure. Imagine paint that never fades. It's stable in water, which is crucial for many applications, and can even be redispersed from its dried form, making it versatile for industrial use. What's particularly significant from a regulatory standpoint, and a key insight from our sources, is the presence of sulfate groups on its surface.
Okay.
This chemical feature is what distinguishes it from regular cellulose and, under Canadian regulations, unequivocally makes it a new substance.
Ah, so not just a new material, but a legally new substance.
Exactly. And that classification triggered the need for extensive safety evaluations before it could be widely introduced to the market.
That must have required an absolutely rigorous battery of tests, almost like proving its innocence from scratch.
Precisely. And those safety evaluations were indeed rigorous and comprehensive. The journey to market included a whole series of physical, chemical, ecotoxicological, and toxicological evaluations. These weren't just cursory checks. They involved internationally recognized OECD tests for things like skin sensitization, oral toxicity, bacterial mutation, chromosome aberration, micronucleus tests. The works.
And the result?
The good news, and what makes NCC such a landmark case, is that these comprehensive assessments demonstrated its low toxicity to aquatic organisms and mammals. So in 2012, NCC made history. It was the first nanomaterial to be added to the Canadian Domestic Substances List, or DSL, without any restriction.
No restrictions at all.
None. This wasn't just a win for the company, Celluforce, it was a watershed moment. It proved that rigorous, proactive safety assessment can successfully pave the way for novel nanomaterials. It set a crucial precedent for future innovations and challenged the perception that all nanosubstances are inherently too risky to regulate effectively. It offers a powerful template, really, for how we can responsibly introduce these cutting-edge materials.
That's a truly encouraging success story, showing what's possible when science and regulation work hand in hand. But now, we must address the other side of this coin. Despite these incredible advances and the immense promise, we have to acknowledge that nanotechnology, like any powerful new frontier, is a double-edged sword. There are inherent risks, hazards, and safety concerns that we often group under environmental, health and safety, or EHS.
You've hit on a core challenge that runs through all our sources. The development and production of nanomaterials are proceeding at an almost dizzying pace, much, much more rapidly than our ability to gather crucial toxicological and exposure information.
So the science is outpacing the safety checks.
In many ways, yes. There's a fundamental lack of understanding about basic toxicology, how these materials actually interact with living systems at that scale. We lack reliable characterization strategies, knowledge about the environmental fate and transport where these materials end up, and the occupational hazards they might pose to those working with them. It's almost like we're building a super fast, incredibly powerful vehicle, but we haven't fully understood how the brakes work or, what happens if we crash. This gap between innovation and understanding is perhaps the most significant hurdle.
That rapid pace versus this critical knowledge gap isn't a new phenomenon, of course. Our sources draw some chilling historical parallels, don't they? Reminding us that we've seen this play out before.
They do. Events like the BP Deepwater Horizon oil spill are cited as a tragic reminder of how risky implementation of new technologies can have far-reaching negative impacts when the technology outpaces our ability to predict and minimize risks. It really emphasizes the lessons of the past, theme that is so critical when discussing emerging technologies like nanotechnology.
Yeah.
We cannot afford to rush in blindly because the consequences can be catastrophic.
And it's not just missing data, right? It's deeper than that.
Yes, and it's not just missing data, which is concerning enough. As Maynard and Pui pointed out in their seminal 2006 work, there's a problem of what they call deep uncertainty.
Deep uncertainty, what does that mean?
It goes beyond simply lacking specific numbers for our models or being unable to quantify certain risks. We're talking about structural uncertainty regarding the fundamental aspects of risk assessment for nanoparticles. We don't fully understand the precise characteristics that truly affect their toxicity. We lack comprehensive knowledge of their ultimate fate and transport through the environment. We're still grappling with what the proper exposure metrics should even be. Is it mass, surface area, number of particles?
So we don't even know what to measure properly.
That's part of the challenge. We don't fully understand how they translocate within biological systems or even the precise underlying mechanisms of toxicity and disease they might cause. The truly unsettling insight here is that the very fundamental tools and assumptions we've relied on for decades to assess risk, especially in environmental health, might be ill-equipped to handle the unprecedented complexities of the nanoscale.
Wow.
It demands a paradigm shift in how we approach safety for all emerging technologies, not just parametric uncertainty, but uncertainty about the actual causal mechanisms themselves.
That's a powerful and, frankly, a bit unsettling insight. This profound uncertainty necessitates a fundamentally cautious approach, especially when we delve into the specific health hazards of nanomaterials themselves. Okay, so let's get into that. Here's where it gets really interesting and concerning.
Yeah.
One of the very things that gives nanoparticles their incredible functionality, their inherent multivalency, which allows for all sorts of surface modifications.
Right, that ability to customize them.
Exactly. That also means they have an enormous surface area relative to their mass. And this large surface area isn't just a benefit, it could be incredibly harmful by exposing a far greater number of surface molecules to cellular components than a larger particle of the same material would.
It's a double-edged sword indeed. The very property that makes them so powerful also makes them potentially more reactive and toxic.
And is this potential for harm theoretical, or are we seeing actual evidence?
Unfortunately, it's not just theoretical. Studies have reported the carcinogenic potential of engineered nanomaterials, as noted by Suda and colleagues in 2009. What's particularly alarming, and a critical warning from our sources, is research demonstrating that some types of multi-walled carbon nanotubes, or MWCNTs, have been shown to induce mesothelioma in rats.
Mesothelioma. That's the cancer linked to asbestos, isn't it?
Precisely. This finding, reported by Nagai and others in 2011, raises extremely serious concerns about asbestos-type pathology. Given the devastating long-term history of asbestos exposure and the horrific disease it causes, this similarity is a critical red flag that we absolutely cannot ignore. It underscores the need for extreme caution and thorough investigation.
That comparison to asbestos is chilling. Beyond cancer, are there other direct toxic effects we're observing?
Yes, unfortunately. We're also seeing other direct toxic effects. Exposure to both single-wall and multi-walled carbon nanotubes can lead to pulmonary inflammation and fibrosis, essentially a scarring of the lungs that can impair respiratory function. And it's not just the lungs. Inhaled ultrafine manganese oxide particles have been shown to translocate from the lungs to the central nervous system, as detailed by Elder and colleagues in 2006.
They can get into the brain.
That's what the evidence suggests. This raises significant neurotoxicity concerns, indicating that the impact of these tiny particles can be systemic, affecting vital organs far from the initial point of exposure. Their small size allows them to bypass many of the body's natural defenses.
That's a truly complex picture then. Delving further into specific materials, what about those metal and metal oxide nanoparticles we mentioned earlier, like silver, titanium dioxide? Do they carry similar risks?
They present a mixed picture of benefits and hazards, which really highlights the nuance required in this field. Take silver nanoparticles, or AGNPs. While incredibly beneficial in antimicrobial applications, as we discussed.
Right, in food packaging and things.
Exactly. But studies have shown they can cause toxicity to the liver of Wistar rats, as reported by Espinosa Cristobal et al. In 2013. Other research by Song et al. In 2013 observed decreased lung function in Sprague dolly rats following exposure. And it's complex because while agglomeration where particles clump together can sometimes reduce their toxicity by effectively making them larger and less bioavailable,
Okay.
conversely, changes in the surrounding environment, like media ionic strength, can actually promote the release of harmful silver ions, increasing their toxicity. So their behavior isn't static, it really depends on the environment they're in.
Then we have titanium dioxide, TiO2, and zinc oxide, ZNO, nanoparticles. These are incredibly common, right? Especially in things like sunscreens and cosmetics. What are the concerns with these?
Yes, these are particularly relevant because of their widespread consumer use. The concern here is that TiO2 nanoparticles can induce free radicals in human cells.
Free radicals. Those are damaging molecules.
Highly reactive molecules, yes. They can cause inflammation and DNA damage, as Magdalnova and others found in 2014. Now, the International Agency for Research on Cancer rates TiO2 as an improbable human carcinogen overall.
Okay, that's somewhat reassuring.
But ultrafine TiO2 particles, specifically in the 10-20 nanometer range, have been shown to cause oxidative DNA damage, lipid peroxidation, and micronuclei formation, all indicators of genetic damage in human bronchial epithelial cells, according to Gur et al. In 2005. And for ZNO, zinc oxide, while it's a potent biocide used in many applications, its disposal is actually restricted in many nations because of its proven environmental impact and toxicity to aquatic life.
So even the materials we consider relatively benign or use every day can have these hidden nanoscale dangers. But is it all grim news? Are there any exceptions to this rule of potential hazard?
Thankfully, yes. Our sources also point to notable exceptions that offer a glimmer of targeted safety, like Ceria nanoparticles or nanoceria.
Nanoceria, what's special about them?
These have actually demonstrated remarkable therapeutic effects in some studies, protecting cells from degeneration, reducing harmful reactive oxygen species, and even shielding normal cells from radiation in cancer treatment contexts. This seems to be due to their unique redox chemistry, allowing them to act as powerful antioxidants, as Su and colleagues highlighted in 2009.
So they can actually be protective.
In certain contexts, yes. This really underscores that not all nanomaterials are equally hazardous. The critical insight here is that specific properties, careful engineering, and a precise understanding of their interactions truly matter in determining their safety profile. It determines whether they become a hazard or a therapeutic marvel.
Given these potential hazards and the unique ways nanoparticles interact with biological systems, it's clear that occupational health and safety in the nano workplace is an absolutely critical area of focus. My mind immediately goes to the workers who are on the front lines, directly handling these substances daily.
You're absolutely right. The workers' challenge is significant and distinct. Those in nanotechnology-related industries face potential exposure to uniquely engineered materials whose long-term health effects are still largely unknown. One particularly alarming aspect we touched on is the ability of some nanoparticles to circumvent the blood-brain barrier, that natural protective shield for our brain.
Which is great for drug delivery.
Exactly. Great for targeted drug delivery in medicine, but for workers exposed to these materials, it also amplifies neurotoxicity concerns. The potential for harm to the nervous system is much higher than with larger particles that can't cross that barrier.
And understanding the exposure routes is paramount for protection. How are workers most likely to encounter these nanoparticles?
Inhalation is a major concern, particularly for aerosols or fine powders generated during manufacturing or handling. Ultrafine particles, those less than 100 nanometers, can penetrate deep into the respiratory system, far beyond where larger dust particles can reach.
Down into the deepest parts of the lungs.
Yes. Once there, they can cause oxidative stress, leading to inflammation and cellular damage. And they can even translocate from the lungs to the cardiovascular system or other vital organs, as discussed by Quadras and Marr in 2010.
But it's not just breathing them in.
No, it's not just inhalation. Dermal exposure through direct skin contact from manufacturing processes or even from handling products like coatings or composites, and oral exposure from accidental ingestion, perhaps via hand-to-mouth contact or through contaminated food packaging, are also critical routes that need careful consideration in the workplace and for consumers, too. The pathways are numerous and often subtle.
It sounds incredibly challenging to even track these tiny particles, let alone protect against them. What are the biggest difficulties in measuring and assessing exposure in a real-world setting, like a factory or a lab?
You've hit on a major hurdle: measurement challenges. It's incredibly hard to distinguish engineered nanomaterials from naturally occurring ultrafine particles that are already present in the background air, things like diesel exhaust fumes, pollen fragments, even smoke from cooking.
So the background noise is high.
Very high. Traditional measurement methods often simply count particles or measure their total mass, but they don't specifically analyze the identity or source of those particles. This raises a fundamental question. What should we measure to accurately assess risk?
Right. What's the right yardstick?
Exactly. When it comes to dose metrics, the traditional mass dose metric, which works reasonably well for larger particles, has been shown to be a poor predictor of toxicity for poorly soluble nanoparticles.
Why is that?
Because their unique surface area and reactivity are often far more important biologically than their sheer weight. Instead, our sources suggest that particle surface area dose, a concept pioneered by Oberdorster and others back in 1994, and maybe particle volume, as explored by Morrow in 1988, seem to be much better predictors of lung responses in animal studies across a range of particle sizes. And we must remember that agglomeration, when particles clump together, also significantly influences the actual dose deposited in the body, which adds another layer of complexity to accurate assessment.
So it's not just about how much material is present, but its specific physical form, its surface, how it interacts. This deep uncertainty we talked about earlier is clearly playing out here in the measurement challenge.
Precisely. Beyond just the quantity or the aggregated state of exposure, the physicochemical properties of the nanoparticles themselves are profoundly important. Factors like particle size, shape, total surface area, surface reactivity, solubility, and any chemical functionalization attached to the surface. They all play a crucial interconnected role in influencing toxicity.
So a needle shape is different from a sphere.
Potentially very different in its biological effects, yes, even if they have the same chemical composition. These attributes affect not only the initial internal dose that reaches an organ, but also the toxicity observed at that target organ and potentially at distal organs throughout the body. The degree of agglomeration, for instance, can even affect the dissolution rate of soluble particles, which in turn influences the release of potentially toxic ions. It's a complex interplay where every characteristic matters, demanding a holistic and detailed understanding.
So given all this uncertainty and complexity, how do workplaces manage these risks now?
Well, in the absence of comprehensive toxicity information specifically for every novel nanomaterial, which is often the case, control guidance has largely relied on our existing experience with ultrafine particles and gases. This means implementing standard industrial hygiene measures. Things like source enclosure to contain the materials, local exhaust ventilation to capture airborne particles right at the source, and personal protective equipment, or PPE, for workers' respirators, gloves, protective clothing.
Standard stuff, but maybe needing extra vigilance.
Extra vigilance, yes. But beyond the physical controls, a deeper, more robust ethical framework for the workplace is also absolutely essential. The principle of respect for persons, a cornerstone of bioethics, demands acknowledging each worker's inherent right to a safe and healthful work environment. This places a clear, unwavering duty on employers to secure these rights.
And what does that mean when the risks aren't fully known?
Critically, it means that in the absence of adequate, definitive information about nanotechnology hazards, this ethical principle dictates that employers should use more, rather than fewer, control measures. It's about being proactive and erring on the side of caution when uncertainty abounds.
That proactive ethical approach to safety truly shines in facilities that design safety from the ground up, rather than trying to retrofit it later. Can you give us some examples of that?
An excellent example comes from the BNC facility at Purdue University, a large university research facility focused on bionanotechnology. Even before formal prevention through design, or PTD, initiatives became widespread, this facility was specifically designed with safety integrated from the start. They employ a clear hierarchy of controls, starting with the isolation of nanomaterials within enclosed systems, moving through the rigorous control of aerosol properties to prevent airborne release, and ending with robust PPE for anyone interacting directly with the materials.
What kind of design features are we talking about?
Key features include customized safety training tailored for everyone, from theoretical researchers to lab users. A meticulously designed clean room with utility distribution located in a separate subfab area below, which isolates potential contamination sources away from the main workspace. They have innovative bulkhead-mounted fume hoods that physically separate the operational side of the lab, where people work, from the maintenance side, preventing cross-contamination during service. And they even have dual gas monitoring systems, using both chemically coated tapes and catalytic sensors for comprehensive, redundant protection against leaks. It's a real testament to how foresight and investment in design can create incredibly safe environments for cutting-edge research.
That's truly impressive, thinking ahead to that degree. And what about the nanocrystalline cellulose plant we discussed earlier, the NCC success story? Do they also employ a similar precautionary approach during production?
Absolutely. Another excellent case study of applying the precautionary principle comes from the Celluforce NCC plant. During spray dryer operations for nanocrystalline cellulose, which, as we mentioned, is produced as a very fine powder, much like talc.
Right, potentially dusty.
Potentially dusty, yes. There was a measurable increase in airborne particulate, about 2 to 3 times over background levels during that process. Now remember, NCC had demonstrated low toxicity through extensive testing.
So technically, maybe less protection was required.
Perhaps based purely on the known toxicity data at the time. However, despite this low toxicity profile, the mill personnel adopted a highly precautionary approach. They provided workers involved in that operation with full head-covered hoods equipped with air-purifying respirator systems.
Even though the material was considered low risk.
Exactly. This wasn't necessarily mandated by regulations at the time for that specific material. It was a proactive, ethical decision by management and safety teams to prioritize worker health in the face of any uncertainty about inhaling airborne nanopowders. It highlights a crucial commitment to worker safety and the precautionary principle in action, even when the known hazard seems low.
Okay, so we've covered the incredible applications and the very real, often hidden risks. The picture we've painted so far is one of immense potential, shattered by equally immense uncertainties. So, with these incredible applications and very real, often hidden risks, the urgent question becomes,
How do we, as a society, begin navigating this complex regulatory and societal landscape? This is where things get even more complicated, right?
Absolutely. The challenge is that existing regulatory frameworks like the Toxic Substances Control Act, TSCA, the Federal Insecticide, Fungicide, and Rodenticide Act, FIFRA, the Resource Conservation and Recovery Act, RCRA, and CERCLA, the Superfund law in the U.S., and various EU directives. These are currently being applied to nanotechnology. However, their adequacy for these novel materials is constantly being questioned.
Yeah, they weren't designed for stuff this small.
Essentially, yes, they were simply not designed for matter at this scale, with these unique properties and potential behaviors.
So there's a lack of specific rules for nano.
Precisely. There's a significant lack of specific nano provisions within these existing frameworks. In the EU, for example, while there is a broad framework directive for worker safety, it doesn't contain any specific provisions tailored to the unique behaviors and potential hazards of nanotechnologies. Similarly, the U.S. Environmental Protection Agency, EPA, tends to examine significant new uses of existing chemical substances on a case-by-case basis.
So reacting rather than setting broad rules.
Exactly. They are responding to individual applications rather than issuing comprehensive blanket rules for all nanoscale materials. This piecemeal, reactive approach can create significant gaps and inconsistencies, leading to regulatory uncertainty for both innovators and the public.
So it sounds like the current system is trying to fit a square peg nanotechnology into a round hole existing regulations. That's why there are growing calls for specific regulation, right? People saying we need rules designed for nano.
Absolutely. The scientific community, public advocacy groups, even some regulators recognize this gap. The European Parliament, way back in 2009, for instance, explicitly called for nano-specific provisions to be included in cosmetics and food legislation.
But focusing on consumer products first.
Right, indicating a clear readiness to adopt more targeted regulations for these products, which are in direct contact with consumers. Similarly, the U.S. Food and Drug Administration, the FDA, has also recommended specific guidance for manufacturers to help them navigate this complex space, offering a proactive step even in the absence of explicit new laws. This movement towards more bespoke, nanotechnology-specific regulation shows a growing acknowledgement that current frameworks may simply not be sufficient for the unique challenges these materials present.
And the uncertainty isn't just with government regulators. How is the private sector, specifically the insurance industry, reacting to these novel, often poorly understood risks?
Well, the regulatory and scientific uncertainty profoundly impacts the insurance perspective. Our sources describe the industry as facing a fear phase.
A fear phase.
Yes. Given the inherent uncertainties about liability for potential property damage, bodily injury, and especially long-term environmental impacts, the insurance industry is naturally very cautious. Their concerns are significantly heightened by studies, such as the one by Poland and colleagues in 2008, suggesting that certain carbon nanotubes might resemble asbestos in their toxicological profile.
That asbestos comparison again?
Yeah.
That would definitely scare insurers.
It exacerbates fears of long-term, widespread claims, reminiscent of the massive asbestos crisis. Consequently, many insurers are adopting a wait-and-see approach. They're reluctant to underwrite risks they cannot adequately assess or price.
So they're holding back.
Largely, yes. To try and address this, tools like multi-criteria decision analysis, or MCDA, are being explored. It's a structured way to try and weigh different factors and aid risk management decisions in this highly uncertain environment, trying to bring some quantitative clarity to the qualitative fears.
So if we have these significant knowledge gaps hampering regulation and scaring insurers, how do we start to fill those gaps and make more informed, data-driven decisions?
This is where nanoinformatics enters the picture.
Nanoinformatics. That sounds like a fascinating and crucial area. It focuses on data-driven materials design, aiming to bridge the void between our emerging understanding and, well, sometimes a complete absence of knowledge about these incredibly complex materials.
Exactly. Nanoinformatics truly represents a powerful frontier for harnessing data, both for safety assessment and for predictive design. It employs a range of sophisticated tools which can be broadly categorized into hard modeling and soft modeling.
Hard and soft modeling. What's the difference?
Okay, so hard modeling involves highly sophisticated computational strategies, things like atomistic models that simulate molecular interactions or thermodynamic simulations that predict material behavior under various conditions. Very physics-based. Soft modeling, on the other hand, often draws from the life sciences and organic chemistry. It uses statistically based, model-independent approaches, think regressions, neural networks, genetic algorithms, to find hidden patterns in existing data.
So one predicts from first principles, the other finds patterns in data.
Roughly, yes. The overarching goal across both approaches is knowledge extraction. It's about identifying outliers in data, developing robust predictive models for material properties and potential toxicity, and recognizing patterns that allow us to understand and maybe predict material behavior and potential risks before ever synthesizing them in a lab.
So using computers to design safer materials from the start.
That's the goal. It's essentially using big data and AI to accelerate both innovation and safety simultaneously.
That's incredibly powerful. And its application in medicine must be particularly exciting, right? Using it to design better, safer treatments.
Absolutely. In medicine, nanoinformatics can play a pivotal role in designing nanoparticles with powerful benefits for diagnostics and therapeutics. For instance, it can aid in developing novel, non-toxic polymeric materials specifically engineered for vaccine delivery systems.
Like designing the perfect microscopic vehicle for a vaccine.
Precisely. These systems can be designed not only to be highly effective, but also to enhance the immune response dramatically and potentially reduce the need for multiple doses. That significantly improves patient compliance and is a huge boom for global public health efforts. By simulating molecular interactions and predicting biological responses, nanoinformatics promises to accelerate the development of safer and more effective nanomedicines, bringing life-saving treatments to patients faster and, hopefully, with fewer side effects.
This brings us to a truly crucial point about ethical imperatives and the Sustainocene. The European Environment Agency, the EEA, has issued a powerful and, I think, quite humble warning that resonates deeply here. They essentially say that no matter how sophisticated our knowledge becomes, it will always be subject to some degree of ignorance. We have to remain alert and humble about potential gaps in our understanding, especially with such novel technologies.
That humility is absolutely essential.
And it's encouraging, as you mentioned, that the early phases of nanotechnology R&D have, thankfully, been characterized by proactive discussions of potential risks, emphasizing the critical need for regulatory review and public engagement right from the start. It wasn't always like that with new tech.
No, it wasn't. We've certainly seen these lessons from the past play out with other transformative technologies, haven't we?
Oh, yeah. Think about the public's complex relationship with nuclear power or genetically modified foods.
Exactly. In both cases, overpromising their benefits, coupled sometimes with a lack of transparency, led to a breakdown of public trust. And even cultural factors tied to what is natural heavily influence their acceptance, sometimes leading to widespread public resistance. Our sources are very clear on this. The public must play a crucial, active role in risk-related decisions regarding nanotechnology. Their informed engagement isn't just a nicety, it's absolutely essential for societal acceptance and truly responsible development. Without that trust, even the most beneficial technologies can falter.
This is precisely where the precautionary principle becomes so directly applicable to emerging nanotechnologies. It's such an important concept. Can you elaborate on what it truly means in this context? How does it guide us when we don't have all the answers?
Absolutely. The precautionary principle is a guiding light here, especially with that deep uncertainty we discussed. Principle 15 of the Rio Declaration states it clearly. Where there are threats of serious or irreversible damage, lack of full scientific certainty shall not be used as a reason for postponing cost-effective measures to prevent environmental degradation.
So uncertainty isn't an excuse for inaction if the stakes are high.
Exactly. What this means for nanotechnology is profound. It directly challenges policies that demand an unrealistic level of scientific certainty before implementing crucial public health and environmental protection measures. Instead, it urges us to act prudently and proactively in the face of scientific uncertainty when potential harms are significant and potentially irreversible. It shifts the burden of proof, and essentially saying, if there's a plausible risk of serious harm, we don't have to wait for absolute scientific proof before taking protective action. We should err on the side of caution.
That proactive, forward-looking approach leads us to a truly compelling and maybe optimistic vision for the future, often termed the Sustainocene. This really makes you think big. Our sources ask a powerful question that frames this perfectly. Can we afford a nano-enabled industrial revolution given the immense global challenges we currently face? Climate change, resource scarcity, disease, dwindling clean water.
Or perhaps more accurately, the question becomes, Do we have any choice but to look to nanotechnology to help resolve these very global challenges?
Yeah.
In renewable energy, clean water purification, advanced healthcare,
Right.
the idea of a sustainocene suggests that nanotechnology could be the crucial key, or at least a crucial key, to transitioning from our current resource extractive model, dig it up, use it, throw it away, to one that creates truly sustainable regenerative habitats.
Using nano to build better, essentially.
Yes, building a fundamentally better, more resilient future from the ground up, sometimes literally at the nanoscale. It's a grand vision where humanity's long-term flourishing is ensured by designing our technologies and societies to be in harmony with nature rather than depleting it. And complementing that grand vision is the right to enjoy the benefits of scientific progress and its applications, Rebus PA.
Red PA. What does that principle entail?
It's a human rights principle that isn't just about accessing scientific advancements, like getting the latest gadget. It goes deeper. It encourages the scientific enterprise itself to actively contribute to achieving human rights obligations. This means supporting mechanisms for critical analysis and honesty in research, fostering regulatory systems based on a scientific and ethical evaluation of risks, benefits, and cost-effectiveness.
So making sure science serves people responsibly.
Exactly. It's about ensuring that science serves humanity responsibly, prioritizing well-being and sustainability, not just technological advancement for its own sake. It's a powerful call for science with a conscience.
And ultimately, all of this points to the crucial, inescapable need for collaboration for the future, doesn't it? No single country or company can figure this out alone.
Absolutely not. The continuation and expansion of multi-party and multi-jurisdiction collaborations will be absolutely vital for systematically tackling the scientific uncertainties and managing the potential risks of nanotechnology on a global scale. While they're not perfect, voluntary governance regimes, where industries and researchers proactively establish best practices and share data, offer a foundational framework. It's something that can be refined over time, providing a starting point for responsible development even as the science continues to evolve at such a rapid and exciting pace. It's really a collective responsibility.
So we've explored the incredible promise of nanotechnology. From targeted cancer treatments and revolutionary food packaging to materials stronger than steel, all thanks to manipulating matter at its most fundamental level. It's truly astounding. But we've also delved deeply into the profound questions surrounding its risks, the immense challenges in assessing and managing them, and the crucial need for thoughtful regulation, proactive safety design, and genuine public engagement. We truly stand at a unique juncture, where the scientific endeavor and ethical considerations must advance hand in hand, shaping not just new materials, but really our very future.
Indeed. The journey into the nanoscale is not just about scientific discovery. It's fundamentally about shaping a responsible future for all of us. And this raises an important question, I think, for you, the listener, to ponder. As nanotechnology continues to redefine what's possible in medicine, industry, daily life, what specific roles do you think individuals, industries, and governments should prioritize to ensure we harness its immense benefits without repeating the mistakes of the past? How do we build that sustainocene responsibly?
That's a powerful thought to leave you with. And we truly hope this deep dive into nanotechnology has given you a fresh, well-informed perspective on this complex and vital topic. We always appreciate your interaction with our deep dives and for sharing this deep dive with others who are curious about the incredible world around us.
Yes, and if you found this discussion valuable and thought-provoking, please do consider subscribing to the English Bookcast for more deep dives into complex topics, simplified and made engaging for you. Your support really helps us continue these explorations.
Thank you for joining us on the deep dive. Until next time, keep exploring, keep questioning, and stay well informed.